Hello everyone, welcome back to the channel. I'm Mace. Hopefully you like what I'm doing here. Today we're going to be reacting to how Medicare-For-All works in Australia. This should be interesting, coming from a Canadian perspective. A lot of the times in documentaries, I always remember the Michael Mann documentary. I don't know if it was Bowling for Columbine. I think it's the one after he did Bowling for Columbine, because it's not all to do with guns, even though he does talk a lot about Canada in that one as well, because he delves a lot into gun culture and just violence in general in the citizenry in that documentary. But it's one of the ones he does about healthcare, and he constantly talks about, Canada's got this amazing healthcare and stuff, whereas in reality our healthcare system has a lot of issues. It takes a long time to get anything done. That's like, if you have something that's not what they consider life-threatening, like say you need some sort of surgery on your knee or your back, and you have debilitating pain, but you might have to wait like a year or more to get the surgery, unless you want to pay for it out of pocket with a private doctor or something like that. I'm obviously no expert on it, or I'll just say that I'm no expert on it. But it's really important to have good healthcare coverage from your employer, as well as our free healthcare. And you're still going to get a bill, by the way. I was in a really bad car accident one time, and I had some bills to pay that I got in the mail. So I was like, oh, great. Here's some bills from my, trip to the hospital. It was 100% needed. I don't know why we're looking at the Americans' Democratic debate from 4 years ago, but is this the one where they screwed Bernie out of it? Right? They screwed out Bernie, or that was the one before when they propped up Hillary and screwed Bernie.
The 2020 Democratic primaries are in full swing as the candidates argue over the best way to approach policy. One of the biggest policy divides, the role of private health insurance.
We have got to pass a Medicare-for-all single-payer system.
Private insurance is not working for tens of millions of Americans.
The quickest, fastest way to do it is build on Obamacare.
Who's that young man?
Many countries around the world provide government-funded universal health care while offering secondary private insurance. One country that's frequently overlooked? Australia. So how well does Australia's system work compared to U.S. healthcare? In 2017, Australia is estimated to have spent 9.2% of its GDP on healthcare, while the US spent nearly twice that at 17.1%. In other words, Australia spends about $5,000 USD per person, while the US spends over $10,000.
Wow.
Despite spending about half the money, Australia has better or comparable health outcomes to the US. The average life expectancy in Australia is 4 years higher than the US.
82.6? Wow, I'm curious what Canada is. I think Canada is around the same as the States, 78, 79, something like that.
And Australia's infant mortality rate is lower. Additionally, the maternal mortality rate in America is nearly 5 times higher than in Australia.
Well, that's shocking.
Australia's healthcare system is sustained by a publicly funded universal health insurance network called Medicare. Australians can also purchase private health insurance to cover hospital treatments or services that Medicare doesn't cover, such as dental or vision. But private insurance in Australia isn't...
Dental and vision, things like that are the really important ones to have coverage under your employers. I'm lucky enough to have an employer that those type of things are 100% premiums are covered by my employer, so it's really important to have, because if you don't have that and you need dental work done, you're paying for it out of pocket. And dental bills can be astronomical, man. Astronomical.
Meant to replace Medicare.
I think it's a bit of a given that if you make above a certain amount, you just have to kind of hold your nose and buy in.
That's Dr. Elizabeth Bates. She's an American who now lives and works in Tasmania, Australia. She did her medical training in both countries. For full disclosure, Dr. Bates' husband worked with the Australian government to help digitize citizens' health records.
I hear more from people that...
Just that phrase, digitize Australians' health records. That would send... a lot of the crazies into a frenzy about that. Just the phrasing of that. They'll be bringing up 1984. They'll be bringing up communism, etc., etc. Even though they all have driver's license and millions of other things that are in digital databases. But
that are going through the public system a bit of, well, even if I'm not a private patient, ... So there's always that fear, I think, that people won't be treated as well, which I don't think really plays out.
Most Australians with private insurance receive a government rebate to help cover their monthly premiums. Also, if Australians purchase hospital coverage before age 31, they avoid an extra charge on private insurance premiums for the rest of their lives. Under Australian Medicare, doctors can set their own prices. However, many follow the Australian Medical Association's list of suggested fees. If a doctor charges more than the Medicare standard fee, the patient is responsible for the difference. These out-of-pocket costs are known as a medical gap, similar to a copay in the US. So how does this healthcare scheme stack up against the US when it comes to the chronically ill patients who use the system the most? Crescenda Keith, an American citizen, and Kirsty Wilkinson in Australia both live with a rare condition called Ehlers-Danlos syndrome, which is also known by its initials EDS. The symptoms can vary in severity depending on the individual, making it difficult to characterize.
It's a continuum. Some people have it to where it doesn't affect their day-to-day life, and some people I know are completely bedridden.
Crescenda has changed insurance statuses several times over the years, going from private insurance that offered comprehensive coverage to no insurance to the government-funded system for low-income Americans called Medicaid.
Going through with the private insurance, it was incredibly easy to get something as simple as a geneticist to diagnose me as opposed to a primary care doctor and a rheumatologist, which was amazing. And it actually, because I had racked up so many bills trying to figure out what was going on, that the geneticist, I had no copay, no nothing.
But Crescenda ended up going from having private insurance to having none at all.
To go from that to having nothing is shocking. I did better.
Just a little aside here, like, our health is the number one most important thing that you need, right? That's why you'll have billionaires, that are dying and they're spending every last dollar to try and find ways to extend their life. You give somebody a choice, a terminal diagnosis or $1 billion. They're going to take people would choose their health, over big, huge sums of money and material bullshit. Like, our health is really the number one thing, and sometimes it's a cliche to say, I think, but it's definitely something that I think we all take for granted a little bit. And of course you do, because it's one of the difficult things in life, right? Life has those difficult sides: death, taxes, relationships. But at the end of the day, health and the looming existentialist threat of not being here anymore. People that grapple with that, sometimes it can be quite daunting. But yeah, our health really is the number one thing. So we got to try to stay healthy while we're young and develop healthy habits. I really want to start running. Like, my sister runs marathons, and I'm really impressed with it. So
waiting until I was so sick that they had to admit me to the hospital, and seeing the specialists in there and just racking up those bills, which the hospital ends up writing off anyway.
After a few years of being uninsured, Crescenda was able to get on Medicaid after a long process with a lot of bureaucratic hiccups.
Finally, recently I was approved for Medicaid, which I thought was going to be the best thing ever. That opens the door to a primary care and opens the door to specialists. The specialists are not even in the area. You give me an hour drive to get to a doctor, that's absolutely inaccessible. And at that point, you're kind of like, well, I wish I just had no insurance, because that little aspect of hope is sometimes worse than accept.
Because it really depends where you live too, and there's also huge shortages of people in the healthcare field. It's one of those occupations that's really lacking, especially doctors. Like, we're really lacking enough doctors. It's good luck finding a family doctor if you don't have one already here in Canada.
Accepting the fact that you have no hope. We're looking into filing bankruptcy, because a lot of the medical bills, even though I was low income, for some reason they still went to collection, even though I contacted people. Even some of the medical bills from when I had good insurance, where I was supposed to have no copay, are now in collections because I didn't know about them and I was moving.
By comparison, Kirsty's insurance coverage has been more consistent over her lifetime. She chose to buy private insurance to help cover her expenses. She thinks that investing in private insurance in Australia is worth the extra cost for convenience and peace of mind.
For me, while I'm in private, is you get choice of doctors. Choose when you have treatment, which is a big plus, because in the public system, you can be waiting months. If I didn't have private cover, I think I'd be up for a lot more. Because what some people say is that you should just put the money aside, but the thing is,
sounds like there's
you don't know what's around the corner.
Some similarities there to Australia's system and Canada's system, I would guess.
I'm a huge fan of universal healthcare coverage, but nothing in this world is perfect. If somebody's got an acute problem here, they can get in very quickly, but if it's just sort of a just-in-case safety check, there's a very long wait through the public system, and that makes me nervous because we know the reason we do universal screening is somebody out there's going to have a cancer sitting there quietly, and I would really like them to find that out before it causes a problem and spreads.
Kirsty finds that while her costs may vary depending on her physician and treatment, some of her doctors take into consideration that she's a long-term patient on government disability.
Because I'm on the disability support pension, and the hospital I go to, generally, they actually bulk bill. And the clinic I go to for my MRIs on my knee, for example, they actually bulk bill because I'm referred by a specialist. It really depends on, I think, your doctors in terms of how much they charge you. I mean, there are doctors out there who charge a lot more than others.
Americans and Australians tend to have many of the same opinions surrounding the effectiveness of their healthcare systems. Around 45% of people in both countries.
There can be like the extreme side of things. Has anybody ever seen that film John Q with Denzel Washington, where his son needs a medical procedure and he needs a heart transplant, and the hospitals and the board of directors and the doctors are all made out to be like these really villainous characters that he has to fight, and he ends up taking the hospital hostage and like demanding that they do this heart transplant for his son. I can't remember what happens in the end of that movie, but it's kind of like an extreme example put into like a movie form of some of the issues that go along with the medical system in the US, I guess.
Are concerned that their medical costs will increase over the next decade. There are some differences, though. While both Australians and Americans rank the cost of accessing treatment among the top 3 problems facing their country's healthcare system, only 38% of Australians felt that way, as opposed to 64% of Americans. Australians were evenly split on the biggest issue between cost, staff shortages, wait times, and an aging population. A big difference between the countries is that only 4% of Australians feel that their country's healthcare system needs to be completely rebuilt, while about 23% of Americans feel that way. Crescenda and Kirsty's experiences show that both the American and Australian systems have their problems. But the Australian system does offer more consistency thanks to basic universal coverage.
I think, we're really lucky to have the system we have in Australia. I think Medicare does make it, even though you might
and there you get the Canadian versus American healthcare.
only get half back or whatever when you're seeing doctors. At least you get something back.
Interesting. Yeah, very interesting. Seems to me that Australia has a relatively similar system to Canada, because we have that kind of universal healthcare as well. At the end of the day, the people in the States that are wealthy, the people in Canada that are wealthy, and the people that are in Australia that are, very, very wealthy, they're going to get their procedures and their treatments and their checkups and all of these things that they need or want done. They're going to be able to have them done because of wealth. So it's usually the low income people that these types of healthcare issues are so important to. Interesting stuff, though. Let me know what you think down below. And yeah, I'll be back shortly. Let's get back into some more rugby hits, man. This was a little dry, I know, but it's always interesting and to look at these issues. I enjoy doing it anyways, and kind of dissecting them and just giving or comparing them, I suppose, to systems that we have here in North America. All right, We'll see you on the next one. Later, people.